Indian medical services existed in pre-independence India. I am told, going by popular conversation, empirical evidence, and some historical documents, that it worked wonders at a time when medicine was not too advanced and challenges were much higher than what it is today. The Indian Medical Services (IMS) was a military medical service in British India which also had civilian functions. It served during two world wars and remained in existence until the independence of India in 1947. Many of its officers, who were both British and Indian, served in civilian hospitals. The first sign of the organization began with the establishment of the Bengal Medical Services on 20th of October 1763, with having fixed grades for promotion and service. Similar services then were extended to Madras and Bombay Presidency. In Bengal, increasing military action required the separation of military surgeons from civil surgeons. Each non-native regiment had a surgeon, and over time, the strength of the medical services grew. The Bengal Medical Services had 382 people, while Madras back then had 217 and Bombay Presidency 181. The medical services of Madras, Bengal and Bombay were unified and united after 1857. To mention, this was having independent boards and a single Indian Medical Services that separated from the civil medical services in 1858 was placed under a single Director General. Drawing inspiration from pre-independence India, what can be done today? All of you have witnessed how inefficiently the COVID-19 pandemic has been managed by the present bureaucratic system. Had the Indian medical services prevailed with appropriate financing, the country would not have been affected so badly. Here's what I would propose. Fill all the district health offices with doctors coming through the Indian medical services and conduct periodic third-party assessment into quality control. All district surgeons in every civil hospital must be qualified in public health mandatorily. Every district must have a directory of NGOs competent in public health, sign an MOU facilitated by the district health officer and the NGO concerned with defined scope of action. All coordination and implementation of programs under the Ministry of Health and Family Welfare must be completely handed over to doctors from the Indian Medical Services, not from the Indian Administrative Service. Public health has the highest potential in the 21st century India, and this must be tapped by mainstreaming this discipline. Research bodies like ICMR and other institutions must be headed by doctors passing from the Indian Medical Services and not political appointments. Allocating independent budgets and grants to be sanctioned for all health and development related work must be done by the cadre of the Indian Medical Service. Ideally, I would recommend that this medical service be headed by a separate Ministry of Public Health with a Minister of Cabinet rank to the Government of India. All Indian Medical Service officials must be trained in periodic soft skills in leadership, including what it means to efficiently manage communication both online and offline. When this happens, health system in India will be approached from a professional lens. Disease dynamics and death will be understood from an epidemiological perspective and not a traditional narrative. The entire investment towards health systems in India will be very different then. That is what a new reality will look like for our people, and that is what we as a nation must aspire to realize. What is it that we really want from our country? How do we want our healthcare system to be looked at, to be approached? As on today, 80% of our healthcare expenditure is out-of-pocket spending. Much of our civilians use private hospitals instead of public established government setups. Why is this a problem? Crumbling infrastructure, poor budgetary allocations, lack of staff and human resource, cleanliness, integrating all of this as a mission to develop, to evolve, to nurture social health as an agenda would take us a very, very long way in nation building and thereby achieving universal health coverage, for which India is an aspirant and a signatory. Thank you very much. Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories.